manager for healthcare management programs, both undergrad and graduate. So we just thank you so much. I see so many familiar names, at least. Several of you have attended many of the sessions this week, and so we really just appreciate your time and your dedication to really what is your career. We have tomorrow one last session, and then we have another alumni panel event. So we definitely welcome you to RSVP or just join those as you are available. And again, we'll have a lot of these resources eventually under the student resources tab on both of the web pages, and then you'll be able to link that to YouTube. So more to come on that part. But as we just will get started here, and you have seen all the communication, but we're really trying to make these individual sessions working, action-based sessions for you all. So we really ask that you pay attention, do take some really purposeful notes, ask specifics about how does this relate to your career plans, and what maybe one or two to-do list items you can take from this session. Another thing is that, Dr. Barrett too knows a lot about resources to check out, books maybe to read, articles to check in on as you are preparing for your careers getting into the healthcare space. Specifically today, we're going to talk about healthcare administration and what that looks like, and the path that Dr. Barrett took to where he really is today as far as teaching the next generation of students who will be taking over these types of roles. So what we'll do for today is we'll get started just in hearing about his background, where he went to school, what degrees he got, his first job out of college. And then from there, we'll just dig into some of these questions, and he's got some information to present to all of you. So again, thank you so much for joining us. Thank you for making this whole week just such a success. We'd love to hear your feedback as well as far as other types of topics you wish we would have incorporated, or when we do this again, how we can keep making this a purposeful event. So without further ado, Dr. Barrett, take it away.
Well, I'm delighted. And Quincy and Ray, thank you for putting this together. I mean, how many of you are grateful for the effort and the time and the energy to open some doors and provide some insight? Let's give them a round of applause. There we go. Well, several of you know me. I'm Dr. Britt Berrett. I'll give you a little bit of my background and history, and that'll put into context the direction that I took. And so I'm going to look at the questions on the side. So I'm going to type in there. Look at Saeed's backdrop, the American College of Healthcare Executives. That he's got a, and Sua, what's in the background here? Is that Minecraft? I love Zoom. I love Teams. I love this teleconferencing, and it makes it a lot of fun to connect electronically when we otherwise would not be able to. My background is I'm originally from Canada. I've seen healthcare in a socialized, centralized healthcare delivery system. I've lived outside the country for almost 15 years of my life. Canada, lived in Peru for several years. I, like you, came out of high school trying to figure out what I wanted to do. And I was involved in all sorts of activities and events, and I wanted to find a profession. My father was in the lumber industry, and so I thought, well, maybe I'll go into the lumber industry. I had an uncle in military, thought that might be fun. What I realized early in life is I just wanted to be part of something that was bigger than me, and I wanted to give back to the world in which I lived. I wanted to find meaning, and I wanted to do something that wasn't putting me into what they sometimes call as cubicle hell, where it's kind of, you're just sitting at a desk all day long. Now, ironically, that's how I feel now. I'm in technology hell, but we'll set that aside. Maybe we'll get back to a new normal. But I started looking around, where could I give and serve? And I thought, well, policy and health, a public policy seems to like a good place to be. So my first declared major was political science, and I thought, they don't have any discipline in the political side, and it's kind of yucky. How about economics? And then I realized that I'm not so great with math, or maybe I am. How about finance? And then the speaker came to campus. I went to Brigham Young University, and he talked about a noble call in healthcare, that there is reason and purpose behind it, But the dilemma we have in the healthcare delivery system is not the clinical side, it's the business side. Every complaint that we have about healthcare is not about curing cancer, it's about the administrative functions. How long, why do we have to wait? Why is it so costly? Why are there so many bills? The process doesn't seem to flow, it's convoluted. So I finished my degree in finance at Brigham Young, found my sweetheart, we got married, headed off to St. Louis, and I went to Washington University School of Medicine. I wanted to go to a place that had some clinical background because my business background was what I was all about. And I thought that I wanted to be in hospitals. And so that's the direction I took. And this was in the late 80s. And so I went into hospitals. Now, Quincy asked the question, what kind of jobs have you had before that? I just tried to get involved with every single healthcare related project or event. I was a host for the Special Olympics. I worked in a very low income community clinic. At one point I was an evening administrator, an administrator on call at a major metropolitan hospital. I was a patient relations rep. I went into hospital rooms and asked the patients, how was your stay? Is there anything we could have done better? Blah, blah. I tried to get in as involved as I possibly could in every aspect. When assigned a project, they would say, hey, we're going to do a marketing project. Which team do you want to be on? I volunteered to be on the healthcare team. In those days, I subscribed to a magazine called Modern Healthcare. I sent out letters to people that were in the healthcare space and said, hey, could I talk to you? Could you give me some advice? I was doing my very best because I knew I wasn't the smartest. I knew I wasn't the brightest, but I knew I was really a hard worker. And it paid off. I got into Washington University School of Medicine and got into the graduate program, finished there. And in hospitals, if you want to get into hospitals, there is somewhat of a track. The track is you go to a graduate program, and then from that graduate program, you find an internship during the summer between the first and the second year, and then a residency afterwards. So you you go into a residency, and if you want to do more of a residency, you can do a fellowship. And so I did a fellowship. So I was there for about 3 years in California. And what I did was I worked hard, and I did everything I possibly could to learn about the industry and learn about people. I joined the American College of Healthcare Executives. This is our professional organization. I went to events. I listened to lectures. I remember one entire week, I went to an entire week session on the cardiovascular service line. It was in Las Vegas, and so I went there for a weekend. I tried to involve myself as much healthcare related activities and events as I possibly could. Now, when it came time for me to be promoted, I was well qualified because I worked on everything. Whenever an opportunity presented itself, I volunteered. I ran towards chaos. When there was confusion, I went after that. And so that helped me grow professionally. We had a director of pharmacy who resigned, and we didn't have a director of pharmacy. And so I said, I'll do it. And they said, well, what do you know about drugs? And I said, well, I don't take drugs, but I like pharmacy. So, and so they put me as the interim director of pharmacy. They were having problems with the housekeeping department and transporting patients throughout the hospital. And they said, we got to figure this out. And I said, I'll do it. I'll do it. And so I figured out a patient transportation system. And it wasn't very smart and it wasn't very good, but I was always volunteering. So for me, the question was, did I want to get into a profession that was purposeful and inspiring and surrounded by some amazing people? They just needed the gift that I had, and that's the business. So I stayed in hospitals, went to assistant administrator, associate administrator, chief operating officer, and at 31, so I graduated from grad school at 26. By 31, I was a hospital president in San Diego. And San Diego has got horrible weather. It's 72 degrees every day, all day long. It's just horrible. It's so boring. You know, here in Texas, you have awesome weather. But it was a great experience when we moved out here about 20 years ago and took a job at Medical City and then Presbyterian Hospital Dallas and Texas Health Resources. And I've always followed, for me, I'm a man of faith. So I always follow where God tells me to go. And he told me to prepare the next generation of healthcare leaders. So here I arrived, found Quincy, brought her on board, found Ray, brought her on board, Keith Thurgood and the rest, so that we could build a healthcare leadership program for both undergraduates and graduates. So that's it in a capsule. Quincy, do you want me to start jumping on some of these questions that have been popping up on the side?
Well, let's see. Yes, I have questions at this point as far as what brought him to where he is today, or anything about career choices, school, degrees at this point. Anybody?
While they're formulating those, let me jump on some of these questions. How do we successfully transfer clinical experience into larger hospital setting, and what are the major distinctions between the two? To those who have clinical background, that's additive and that's helpful. What you'll find in healthcare is we're trying to figure things out. If you're the kind of person that likes to figure things out, healthcare leadership is for you. If you're the kind of person that just wants to be told what to do, it's probably not the place for you. Go into accounting. Just kidding. If you want to be able to figure out how to work with people and commit resources in a specific area, that's what healthcare is trying to figure out right now, because the shortcomings in healthcare are completely related to the infusion of smart business practices. Euphemistically, we call it the practice of moving from the bench to the bedside, from the clinical research to the application, to figuring out what's going on medically, to how do we apply that and provide that and improve quality, access, and do it efficiently. Having a clinical background is helpful, but it's not necessary. I don't have any clinical background whatsoever. What you do need, I think, is an ability to, number one, work effectively with people. Number two, to figure out how things come together. A couple of behaviors that I think are important is be proactive, be ambitious, be curious. I found that curiosity is probably the most underrated skill or behavior. People get upset all the time about this and that, why it won't go the way they wanted it to go. I'd rather be curious about why it didn't go the way I thought it would go and listen. So move from furious, upset, to curious. Why didn't it work the way you want? Any of us that have been frustrated with this pandemic, right? I can't get a job, blah, blah, blah. I'd be curious about what opportunities does it open up? Look at telemedicine. Look at consumer behavior. Look at the exclamation point that people are attributing to healthcare. As we get closer to the election, you're going to hear more and more conversation about healthcare. And if one party gets in or the other, healthcare is going to be a top topic. Would you not agree? We're going to talk about how we fund healthcare. Some will say Medicare for all. And those that are in my classes I've helped them navigate what that means. Some have said, hey, listen, it's not my problem. I'll give you pricing transparency. Matter of fact, I'll give you most favored nation spending in pharmaceuticals, but hey, if you get sick, that's your problem, right? So there's different views of this, but it is a contemporary and purposeful issue that new healthcare leaders that move to curious to figure this out will be successful. I had a student, she was frustrated that when she went to a doctor's office that she had to wait. And if you've had that experience with yourself or a loved one, why do you have to wait 2 hours, right? You can get into Chili's faster than that, can't you? Chili's gives you a little thing and it beeps you and you can shop and you can go eat. Why can't you do it at the doctor's office? Well, she created a product called DocuPage. And now it's a company. It's received a number of awards. She was an undergraduate student I taught years ago and received all sorts of awards for this DocuPace. But it basically alerts patients that their visit has been postponed and that they can reschedule via their cell phone. How cool is that? So moving from furious to curious, then you find all sorts of ideas. Now, another questions that were asked were, would I go into hospitals again? I think hospitals present a unique opportunity because it's a third of all healthcare spending. And if you get a business degree, you can go into the revenue cycle, meaning the billing office, the admitting office, the insurance functionality. You could also go into marketing or strategic planning. You could go into the administration, which is the operations of the hospitals. There are jobs there, it's a third of the spending. Where I think the real action is in post-acute and ambulatory, meaning when a patient is discharged from the hospital, where do they go? What kind of care will they receive? Majority of the patients go into skilled nursing or assisted living, right? But what about patients that want to be cared for at home? I have a friend who's, you know, these tiny homes, calls me up and says, hey, we want to build some tiny home resorts, but that are medically accessible. And so I was giving some counsel and advice on what a tiny home would need for a family member who wants their privacy and but they're not sure they can live on their own. So a tiny home in maybe the functionality of a guest home, but which has medical alerts would be ideal. Think about that as a marketing opportunity. So we look at the post-acute side, there's a lot of growth there. Every day, 10,000 people turn 65. That's the magic number when you're old. I'm old, or almost there, okay? And someday I'll be calling you. I'll call Mehul from my nursing home, and I'll say, buddy, come visit me, I'm lonely. No, I won't say that. I'll say, Mehul, I know you're the president of the hospital company of America. Hey, can you throw some diapers my way? You know, who knows, right? But post-acute, there's going to be a lot of activity. The other area where I think there's more action is ambulatory. So we're seeing a majority of the patients are moving from the hospital-centric care into outpatient. You've seen outpatient surgery centers? Well, take that to the next degree. We're looking at hip replacements on the outpatient setting. That's where you slice the patient open, you insert and bolt in a new joint, you zip them up, and then you discharge them to home. Wow. Think about that. Well, the reason they can do that, it's minimally invasive. They have prophylactic or pre-surgical care and then post-surgical care. I think ambulatory is where a lot of action is going to be. Physicians' office practices, using consumers' desires for telecommunicating. We laugh about, you know, drones delivering your drugs, right? We laugh about that. How about self-driving cars as an ambulance? Elon Musk is going to do that, or one of you is going to design that. Why not? Why? You know, we look at technology. Healthcare has been reluctant to infuse new technology for decades because they're fearful of the change. Telemedicine. We didn't want to do telemedicine. Doctors didn't want to do it. Now, if you don't have a telemedicine platform, as a physician, you're pretty much going to go out of business. Imagine what it'll be into the future, and you can be part of that activity. Let's even say, and Quincy, you got to slow me down. I get going on this. So
I was just about to interrupt you, but
please.
I have a question. A question that came up from a student would be, what are some of the entry-level jobs related to those areas you were just talking about? So what can students expect? On the call, we've got from freshmen up through dual MS MBA students. We do have a wide range of audience on this call, but anyway, any thoughts you have about entry-level jobs related to those areas?
The first thing I learned was to network. Now, we had earlier this week 3 alumni that got in, and they talked about how they got their first jobs. And every single one of them was about networking with people. So we have group projects, right? I see some on the call. you've been in my class where we do group projects. One of the students said, yeah, I was in an MS in healthcare management class with another student, and I was interviewing for a job, and that student knew the hiring person. And so, you know, there's a relationship there. When you're in school, be the best partner in group projects and communicate with your peers, your friends. That's why I'm a big HMA. This is the student club. Get involved with it, become an officer. American College of Healthcare Executives has got a mentorship program. And I'm putting a big exclamation point on this because this is one of those things that we don't do, and it's one of the easiest things we can do. When you're on a group project, don't be an idiot. I've got a group right now, and I have one student in that group that I can't give them an I as a grade, but if I could, I would, and it would stand for idiot. Because he's not participating on the team. You've all nod your head if you've had a team member on a project that just has been a pain in the patookie, right? Right? Okay, so be that, don't be that, I use the term Bob. You know, oh gosh, Bob's on our team. Bob doesn't show up. Bob doesn't do the, don't be that person. Be that person that engages, participates, and is active. Now, I saw a couple of hands go up. Daniel, you had a question. He's one of my favorite students, so I'll pick on him. Daniel,
Oh, yeah. I was just raising my hand because I don't have my camera on right now.
Okay, got it. Got it. Daniel, you know what I'm talking about. You've got to be that engaged student. So that's number one. Number two, try any job. Try any job. When you see an opening for an entry-level position, go for it. Admitting clerk, patient relations representative, financial analyst. These jobs pop up. They usually are shared with friends in the healthcare space. Get into an entry-level job as quick as you can, even graduate students. My son-in-law finished his degree in finance, and he volunteered at a hospital, which pivoted him into a transporter job. So here he has a 4-year degree in business, and he's transporting patients around the hospital. The plus side of that is a company came along and they sell interfacing technology, basic nurse call systems. He's still an undergraduate, and they were looking to for someone who had some hospital experience. He goes, that's me. I said, well, you're a patient transfer. I traveled over 1 million square feet of a hospital and office space. I know a hospital operates. He goes, oh, check. So he got himself a job, and it was a fantastic job, but he decided to go back to graduate school. So he applied to all these graduate schools. University of Memphis called him and said, listen, we want you, and we're going to give you a full ride scholarship because you have all this experience. And I looked at him, I said, Landon, you got like maybe 8 months of total experience. What are you talking about? He goes, well, they seem to think I had a lot of experience. So jump in at every opportunity you can. Volunteer at the hospital. If any of you haven't volunteered at a hospital, you really need to. I know we're in a COVID environment. This pandemic will eventually slow things down. My wife's a volunteer at Texoma Medical Center, and they called her up and said, hey, we need someone to come in and do the thermostat, you know, the temperature for all our employees. She says, well, I don't want to work there, but my daughter does. She just got her degree in public health. So Gracie is working at Texoma Medical Center, and she's having that experience. Well, they're moving to DC. NIH is looking for talent. They said, what kind of experience? She goes, well, I work at Texoma Medical Center. I am a patient, some technician. Well, see what I'm saying? So I get as many experiences as you possibly can. I'd be cautious of that too, because I had a really bright young talent call me recently, and they were inviting her to move to Florida, but the pay wasn't very good. So be careful on taking anything, but at this point in your life, if there's a possibility, go for it. If you've got the ways and the means, that's what I did. I volunteered for virtually everything, And when I looked at my resume, it was pretty filled with things that had been done. Does that help, Quincy? Did I answer that, or did I?
Yep, that's great. So I guess kind of on a related note, then, where do you recommend they go in the DFW area? If they are kind of sticking around town, somewhere maybe close to UTD, can you recommend some specific either healthcare systems or organizations where they should start their search?
Well, fortunately, we have some great systems now. Everyone's tapping the brakes right now, right? And they're looking at a second or third wave of pandemic. I was talking to a CEO from St. Louis, and they're seeing a huge surge. So they're tapping their brakes. Be patient on that. Get in as early entry as you possibly can. Baylor Scott White is a fantastic organization. Looks good on your resume. Texas Health, fantastic organization. Looks good on your resume. Medical City, part of the HCA family, nationally known. Looks good on your resume. UT Southwestern, once again, fantastic. We've got some really stellar organizations. I'm struck by how many people live in the DFW and how many opportunities there are for people that are intentional and purposeful. There are some graduate schools out there like Trinity. Trinity in San Antonio is a great graduate program, and it's graduated hundreds of individuals that are now senior executives, but it's in San Antonio, which is a dinky little town, to be quite frank. It's a small town compared to DFW. So there are not as many opportunities. So if you went to Trinity, you would go to San Antonio, but then you would leave San Antonio. That's pretty much the way it goes. In the DFW, you got a great programs. I like our master's program. Dr. Thurgood is really an exceptional leader. That's for traditional students that want to go with a fast track 5 years. If you're not ready for graduate school, tap the brakes, go out and work, be a clerk at a clinic, be a patient relations representative, be an analyst in an insurance company, then come back and get your graduate degree. Dr. Thurgood's program has got a couple of swim lanes, very strong on analytics, very strong on processes. You know, he's got a supply chain background. We've got very strong alumni that are moving through their careers. We don't have a lot of CEOs in the alumni ranks because our program is about 12 years old. I would really seriously consider. There's some other programs in the DFW that are good. TWU's got a good program. UT Arlington has an okay program. You know, when I taught at SMU, they wanted to start a master's program, but theirs is really healthcare policy. So unless you want to get into the policy space, probably would steer clear of that. I'm trying to think of who else has got a program. San Marcos, UT San Marcos has got a good program. Texas A&M has a good program. And there's some really good programs. Ours is unique because we declare we're in the business of healthcare. And that's very, very attractive to healthcare leaders. That's probably the one weakness we have in the delivery system is the business of healthcare. One question here from Blake. How do you feel about medical device sales consulting? I love it. Now, there was a day when medical device sales and pharmaceutical sales was just kind of salesy and kind of schmoozy. So it was kind of like, hey, come buy my product, doctor. Why don't you, prescribe my medication? There was a day when it was like that. Today, the talent in sales are phenomenal. We have an excellent sales program here at UTD. Dr. Dover does a phenomenal job. So if you're looking at biomedical device sales and consulting, I think the sky is the limit because using so much capital that you're going to see more and more innovation. And it's going to be mostly on the ambulatory side. I think technology is exploding as well. So take a look at new technology ideas on creating wearable devices. I mean, right now my phone takes my EKG and and I have this little thing talks to me and tells me, don't eat that ice cream, that kind of stuff. Well, it doesn't say that. I probably should, actually. But imagine if it could measure your enzymes. Maybe if it could be predictive of a heart attack. Maybe if it read your enzymes and said, you're very risky for a stroke, and it calls an ambulance for you. Better yet, it calls a drone, and a drone comes and picks you up and takes you to the hospital. I'm telling you, don't count anything out. The creativity in this space is phenomenal. Okay, Quince.
Well, so you talked a little bit about, the education side of things just a few minutes ago, but are there really classes or concentrations? Do you recommend anything both at the undergrad and graduate level as far as classes that they should be taking in addition to the core course?
UTD is the healthcare management program has 6 required classes. So the introduction to healthcare management is really fun. I think those have taken it with me. It's fun. And we talk about a lot of things. Healthcare IT, that's very basic. None of these classes are weed out classes. There are some classes in the university that, like biology or anatomy and physiology, they just torture you to see if you're up for it. And if you're not, you're toast. I get that. None of our classes are that way. We want to see what you have an interest in. So technology, regulatory, Dr. Tesmer teaches that. We have one in economics. We have one in finance. And then we have the capstone at the end of the year. I like the area of analytics. So once you've taken these core classes, pick up elective classes within the university that are very attractive to you. Ones that people. They like human resources. Some people like analytics. Some people like the accounting space. Some people like making the clock tick, so operations. So I'd recommend that you take classes at the university to find out where your interests lie. Here's a question. One person uses a lead into other activities, meet the customer, gets to a different field. Another really enjoyed the contact. Yeah, Tim, that's Tim. Hey, Tim, you're on the line? Tim Stevens? Dr. Stevens. Calling all Dr. Stevens. My guess is Tim is out on his boat, trolling for fish.
I think he might be rock climbing in Vail.
He could be rock climbing in Vail. Okay, he added a comment in here, which I think is very pertinent. Find out what you like. Find out what you're good at, and then pursue those opportunities. It seems simple.
I have a follow-up question to that. So if you've got a student maybe who has just switched majors, or they definitely know they want to get into healthcare, they just don't know the exact space. Are there any tools they can do or practice activities? How can they really kind of dig into, maybe not even knowing what the options are, how can they dig into some of that to realize, okay, here's what I'm maybe wired to do, or here's my skill set, but here's what I like or want to know more about? What can they do?
A couple of options. Come visit me. I'm on Teams. You can talk with me. You can talk with any member of the faculty. We like to have that conversation as you're trying to kind of figure it out. I'd also say go and volunteer. Get out there. American Heart Association, local hospitals. I know we're in a lockdown COVID. This too shall pass. Volunteer and see what you like and enjoy. Maybe you like, I went to St. Louis. And I got there and I was working full time and going to school full time. I was working the night shift from midnight till 8, and then from 9 till 3, I was going to grad school. Then I was going home and sleeping and then doing it all again. Okay. There was a clinic in downtown St. Louis, a very socioeconomically depressed community, and I thought I should volunteer. I had this feeling that I should volunteer. So I walked over to their clinic. Now, mind you, it was a very ethnically different community. So I'm pretty Caucasian. So I walked in and they all kind of looked like, what are you doing here? And I said, I I'd like to volunteer. And they looked at me like, well, what can you do? And I said, I can clean, I can welcome patients, I can, stock shelves. And so they said, well, why don't you, what was the first thing they had me? I think they had me do supplies. So I was stocking supplies in this clinic. And I started asking questions like, how much do you charge for all this stuff? And they didn't know. And I said, well, have you ever looked at a charge master? And mind you, these are good-hearted people in a clinic in inner city St. Louis. And they said, what's a charge master? I said, well, a charge master is a list of all the prices of all the services that you provide. And they go, well, we never created one of those. And I went, ding, I'm really good at that. Let me create a charge master. So then I interviewed the nurses and the doctors. How long does it take you for an examination? How long for what you would consider a lengthy examination? Do you give vaccination? Yeah. So I listed all those things out, and then we started assigning prices to them all. And they were shocked. Now, the plus side of that is then they could determine the economic activity in that clinic and then apply for grants. Because they could say we saw more than, we saw 20 patients a day, but the economic value of that is X number of dollars. And so we need grant subsidy to help. And my point of sharing that story is try things. Try and see what you like. I did sales. And I'm horrible at sales. Horrible. I hated it. I just don't know how to do it. So I never got into sales. There's a long, funny story about my sales experience. But Quincy, to answer your question, which is a good one, try possibilities, try things. Volunteer. American Heart Association, Relay for Life. Join HMA, attend the clinic, the speakers, speak with the speakers after their meetings. Okay.
Thank you. That's great. Well, so kind of on a related note too on there is, getting to know people in the field. Networking is just a big thing that comes up a lot. And there were a few questions posted last week, and then, one that was just posted here, but talking about advice to maybe establish connections or networking, especially as a college student. Are there things they should join? I just stuck the link to HMA in there as just one option, but advice both to establish connections and then how do you maintain them after you meet professionals, or how do you continue networking?
Yeah, and that's an interesting question because I guess interacting with the CEO can be a little intimidating, right? Okay. Hey, CEO, this is Rita. I'm really cool and I want you to, yeah, I get that. But there are folks that come to campus or alumni who are not at that CEO level. That's why I think you need to look on LinkedIn. Find your LinkedIn and look at how you present yourself. And then Google some organizations and look for UTD graduates. You can sift through that and then just shoot them a note. And I get these messages, gosh, every weekly, if not daily, from students from my alma mater saying, hey, I understand you're in healthcare. Can I just talk to you for 15 minutes? It's that easy. Now, you'll know if the contact and there's a connection there. You'll know. You'll go, that was really fun. Can I call you in a couple months? Sure. Call them a couple months and check up with them. And then you'll know if it just didn't go well. And so you just say, okay, on to my next relationship. Years ago, I had a student call me from the University of Minnesota, and his name was Jeremy Bradshaw. And he said, hey, I'm going to the University of Minnesota. I went to your alma mater. What advice do you have as I go into grad school? And I said, delighted to talk with you. 5-minute conversation, 10-minute conversation. Went off to Minnesota. Just before he was leaving Minnesota, he got a residency fellowship at the Mayo Clinic. And I said, he called me up and said, hey, just check it in, letting you know I'm going to the Mayo Clinic. I said, that's great. Congratulations. I'm cheering for you. Calls me about a year later and said, hey, can you give me some advice? I said, what's up? He says, well, they've got a solid organ transplantation program here at the Mayo Clinic, and I'm just deciding if do I want to go in as a an analyst? And I said, yeah. I give him advice, go for it. Calls me 3 years later. Now, mind you, we're talking about a 7 to 9 year span here of just calling at peak points. Calls me up and says, they've asked me to be the interim director of the solid organ transplantation program. I said, for solid organ kidneys. I said, that's great. About 8 months later, I'm working at Medical City, and we have the 10th largest heart transplant program in the United States, and our director resigns. Who do you think I called? I called Jeremy at the Mayo Clinic, who's over their solid organ kidney transplant. I said, would you like to come to Dallas? He goes, yes. So I hired him, probably paid him 120 grand. He's doing really well there. And he comes to me and he says, I would really like to get into hospital administration and be a chief operating officer and CEO. I said, okay, let me throw my net out. So after a couple of years working with me, Frank called, he got a job as a COO in McAllen, Texas. And now he's a CEO in, where's Jeremy? He'll come to me in a minute. It's a very organic, unstructured, getting to know people. And sometimes it works and sometimes it doesn't. I think UTD's got a phenomenal reputation. So there's nothing to be uncomfortable with of just reaching out to someone and saying, hey, what advice can you give me? I think you've got an amazing career and resume. What would you recommend?
Thank you. That's great. You guys taking notes? Everyone taking notes? I hope so. I'm trying to stick some chat, just things that we hear, little nuggets of wisdom. If you think of things that we don't see, just stick it in the chat, because we have this. You all have access to the chat. After this, you can go back in, maybe watch this again, look through the comments and see what links are in here, recommendations that are made, super helpful.
Where I think healthcare is going, we're $4 trillion. We're 20% of the GDP. We are a big economic engine, and I think it's going to continue to grow. I don't think it's going to slow down. I don't think you're going to see a recession or a readjustment like you see in real estate or finance or manufacturing. You can't outsource healthcare. You can't say, okay, I know you need a hip replacement. We only do that in Taiwan. I mean, you're just not going to see that. Now, there are all sorts of different aspects of healthcare that are kind of neat. Like, and I mentioned, let's feed off that one. How about medical tourism? What about medical tourism? We're doing an exercise now in our introduction to healthcare management class where all the students have to find the price from 3 providers on a hip replacement. You know how difficult it is to get that information from a provider? How much does our hip replacement cost? And so the students are all doing that. And one student called up and said, hey, do I have to do it all in the United States? Because no one's answered my question. I said, well, what do you have in mind? He says, well, my dad is a doctor in Pakistan. And I said, call him in Pakistan. Heck yeah. He calls him up and, it's like, 50,000 here in the United States for a hip replacement and 7,000 in Pakistan. And he says, yeah, but I'm not so sure of the quality. I went, dude, there are some really phenomenal talent in Pakistan. So why don't you check it out? Well, if you're doing hip replacements and the difference is 7,000 to 50,000, I told him, you could build a company that advertises that. You could fly them in a Learjet private jet, put them up at a 4-5-star hotel, have their hip replacement. I don't know what there's to do in Pakistan. You could go tour. You could have a vacation for a month, for crying out loud, and still come home at less costly.
I don't know. You might never come home.
No, stop that. You would come home. Think about I flew to Costa Rica and I'm on the plane and there's this lady sitting beside me and I said, what are you doing on your trip? Going on vacation? He goes, no, actually I'm going to Costa Rica for a vacation and then I'm having a bunch of root canals done. I'm like, yes, I did all my research. It's American trained doctors, dentists down there. And I'm thinking to myself, I should go into medical tourism business. Dr. Barrett's medical tourism to Pakistan. Saeed is not invited to that. He will be my chief operating officer, and I'll make him eat his words. But are you seeing the creativity and the possibilities. Healthcare continues to grow. And this pandemic, man, I mean, we can't get people to wear masks, can we? None of you are wearing masks. What's wrong with you? Put your masks on, okay? What will the future hold? That's thanks. How will we navigate through a pandemic in the future? We talked about telemedicine, drones, honestly. Years from now, you'll get a prescription delivered in a drone on your front doorstep, and you'll say, who was that guy? Who was that